Did you know that one of the biggest medical studies ever done on women's health, the WHI trial, may have been misunderstood for decades? Today we hear from Dr. Howard Hodis, speaking at the FDA panel discussion on hormone replacement therapy and menopausal hormone therapy. He breaks down the actual data on hormone therapy and shows us a very different picture of what most of us have heard. Are hormones really as risky as we've been told? What does the science actually say about breast cancer, heart disease, and dementia? And why do so many women suffer needlessly after 2002? Stick around because this presentation could change the way you think about menopause and hormone therapy forever.
All right, our final presenter is Dr. Howard Hodis. Okay, go ahead.
Here's my disclosures. Dr. McCary, Dr. Brenner, thank you so much for this opportunity to speak to you and our audience. My goal is to present a snapshot delving deeper into the data that support removal of barriers harming women's health. Please focus on my slides. The graph in panel 1 shows the major outcome data from the WHI E-alone trial, that's the upper panel, and the E plus P trial in the lower panel, in these women who were started on HT prior to age 60. As you can see, DVT in the E plus P trial was the only adverse outcome to reach the rare threshold of one event per 1,000 women treated per year. That's the red dashed line. Other adverse events are below this line are rare and statistically non-significant relative to placebo, including, importantly, breast cancer. All-cause mortality, all cancer deaths, and other mortalities are significantly reduced across both trials. Colorectal cancer and all cancer types are reduced. And contrary to claims, lung cancer is not increased by either hormone therapy. All fractures and diabetes are reduced in both trials, and ovarian cancer is not increased with E plus P as claimed. Alzheimer's disease and dementia mortality across all women was significantly reduced with E alone after 18-year follow-up. And with both trials combined, the reduction was significant across both trials. Panel 2 shows the WHI breast cancer data. The upper table shows E alone reduced breast cancer and significantly did so in women who were more than 80% adherent. Breast cancer mortality was importantly significantly reduced by E alone after 20-year follow-up. The lower table shows that in the first E plus P manuscript that led to the media frenzy in 2002, the authors stated that breast cancer almost reached nominal statistical significance, meaning it was not statistically significant. Since WHI was not a simple single outcome trial, adjustments were conducted for breast cancer, which was a priori defined as a monitoring and secondary outcome. Included were adjustments for multiple statistical testing, sequential monitoring, and confounding bias. Each adjustment also showed a non-significant effect of E plus P on breast cancer. Again, breast cancer mortality was importantly unaffected by E plus P after 20 years. Note in the last row of the bottom table, women without prior hormone therapy use before entering the E plus P trial, that is hormone-naive women, that is the women we treat, showed a non-significant hazard ratio close to 1. In panel 3, the first graph showing hormone-naive women, breast cancer incidence in the E plus P treatment arm, shown by the blue line, was not significantly different than breast cancer incidence in the placebo arm, shown by the red line. In the second graph of women with prior hormone use, breast cancer incidence in the E plus P arm shows a similar incidence as the women in the hormone-naive group. Compare the blue lines. The elevation in the hazard ratio results from the anomalous reduction in the incidence of breast cancer in the placebo arm of 0.25%. Compare this with the breast cancer incidence in the placebo arm in the hormone-naive women of 0.38%. This anomaly in the data was further amplified in women who were more than 80% adherent with treatment, with placebo rate reduced to 0.15%. The WHI observational study from 32,000 women, given as the green numbers in the graphs, externally confirmed that the very low breast cancer incidence in the placebo arm anomalously raised the hazard ratio, falsely giving the impression that E plus P in the women with prior hormone use was associated with breast cancer. On scientific grounds, the claim that WHI demonstrates an increased risk of breast cancer is not justified by the published data.
This is huge. For years, women have been terrified of hormone therapy because of headlines claiming it increases breast cancer risk. But here we see the actual long-term data showing the opposite. Not only is the risk not significant, but overall cancer deaths were actually reduced. This is a classic case of how one misinterpreted study can ripple across medicine and cause decades of fear.
Meta-analyses of other HT randomized controlled trials confirm this conclusion as shown in the green box. For comparison, table in panel 4 shows examples of 3 commonly used medication classes associated with breast cancer with relative risks 2 to 4 times greater than that seen in WHI and are statistically significant. All medications we use in the practice of medicine have side effects. Graph in panel 4 is the Cochrane meta-analysis, which represents data that consistently show HT reduces coronary heart disease 50% and all-cause mortality 30% in women starting HT when less than age 60 or within 10 years of menopause, shown by the green bars.
Think about that. A 50% reduction in heart disease, which is the #1 killer of women, and a 30% reduction in death from all causes. These aren't small effects. If this were a new cholesterol drug, it would be headlines. Yet because of the WHI backlash in 2002, millions of women missed out on these benefits.
Women greater than age 60 or 10 years beyond menopause when starting HT show no benefit. This is represented by the red bars. The Cochrane meta-analysis also showed no effect on stroke in younger postmenopausal women started on hormone therapy. In summary, the risk-benefit profile for HT is excellent, including reduction in all-cause mortality and cardiovascular disease, the #1 cause of death in women, with rare, statistically non-significant risks, including that of breast cancer, in the very women started on hormone therapy. It is past time to stop overstating risks and promoting fear and confusion about hormone therapy, which has been shown to safely offer life-enhancing and life-saving benefits for countless menopausal women. Thank you.
So let's sum this up. The risks of hormone therapy were overstated, especially when started early in menopause. Breast cancer fears? The data just don't support them. And the benefits, like cutting heart disease in half and lowering overall mortality, are life-saving. This is why it's so important to revisit the science, not just the scary headlines. If you found this video eye-opening, hit the like button, subscribe for more evidence-based reactions, and share this with someone who needs to hear the truth about hormone therapy. Women deserve accurate information, and together we can help spread it.